Well, hello, and thank you for joining me. If you haven't already watched my video on the adrenergic agonists and antagonists, please watch that first because it'll make a lot more sense if you understand that classification of drugs before you start studying the opposite, which is this classification of drugs. So this classification is going to be on the cholinergic agonists and the anticholinergics. So if you remember from the adrenergic video that I did, we talked about the differences between the sympathetic nervous system stimulation and the parasympathetic system stimulation. And with the adrenergic, we thought about adrenaline, epinephrine, and how that you want to think about that like you're running from a bear. And you're going to have all of those symptoms as you would if you were running from a bear. You will have your pupils dilate because you need to see better. You will have your lungs expand because you need more air. You will have your heart rate and blood pressure go up as you're running from that bear. So this time we're going to think about the direct opposite of that. We are going to be thinking about the parasympathetic system. And again, you don't have to memorize a whole bunch of different symptoms because that can be confusing. You want to just think about what the opposite is of that running from a bear symptom. So just memorize those once. And we're talking about the opposite in the parasympathetic system. Or what would happen if you're done running from that bear or taking the exam and you're now resting and digesting? What will happen inside your body when you think about that? Well, in the parasympathetic system, the neurotransmitter that we're talking about is acetylcholine, and the receptor is the cholinergic receptor here. So again, remember, parasympathetic, rest and digest, cholinergic, acetylcholine. We call this the drugs, the parasympathomimetic, meaning mimics. Remember that word there. So again, if you are a visual learner, it is easiest if you look in your Karch text on page 538, figure 32.1, and you can see the parasympathetic stimulation, that rest and digest, which is opposite of the sympathetic system stimulation or fight and flight. The cholinergic drugs, you will see it's fuzzy again on this slide, but it is not fuzzy in your text, and you can see that there. But you will see pupil constriction. You will see increased salivation to help you with your digestion. You will see increased secretions again. You'll see decreased heart rate, you're resting, increased GI motility, all to help the body rest and digest. You need saliva to eat and digest, so that parasympathetic stimulation will increase those secretions. Remember, these are all things that you don't need when you're running from the bear, but you do need to be able to rest and digest. So now, can you think of a drug that would stimulate? Now you're thinking agonist. The parasympathetic system, so now you're thinking cholinergic to help with Alzheimer's. If you want to pause the video, I think that's a good idea to kind of think about it, process the information that you just learned. Again, remember cholinergic agonists, that would be, right, donepezil. Anticholinergics, an example, opposite of that would be atropine. And again, remember the parasympathetic agonist will stimulate the acetylcholine receptors, increasing that rest and digest. So that's right, donepezil. It's an indirect acting cholinergic agonist because it blocks acetylcholinesterase. And if you think about that word, it ends in ase, which means enzyme. And if you have an enzyme, acetylcholinesterase, that enzyme breaks down acetylcholine. And we don't want the acetylcholine broken down in Alzheimer's because that is what leads to their decreased memory. So if you have this drug that is stopping that enzyme from breaking it down, you're going to have an increase in the acetylcholine. So you will have an increase in this patient's memory for Alzheimer's. And so, what adverse effects might you notice with this cholinergic agonist? And I would recommend stopping the video and thinking it through, thinking about what you learned. Go back to your book, see if you can find those symptoms, and then resume the video when you're ready. Are you back? So remember, you're stimulating agonist, the parasympathetic nervous system. So you're increasing that rest and digest, the opposite of the sympathetic nervous system stimulation. So contraindications would be bradycardia, asthma. Adverse effects you may notice also are diarrhea, more fatigue, all those things that will increase that rest and digest. And if it's already happening, those are your contraindications or adverse effects. So you don't, again, have to memorize, just think about it and learn it until it makes sense to you. Also, there may be an increased risk of GI bleeding with NSAIDs. Don't forget about that. And then also always remember when you're thinking like a nurse, you want to think about what is this medication given for? And if this medication is given to increase a patient's memory, you always want to make sure that you are assessing that before you give that medication. So you're going to assess their memory. You're going to assess their orientation, right? That's that nursing process, assess, and then diagnose, plan, and implement. So you can't give that medication until you know what their baseline is. Great job. Okay, so now think about the opposite of that. So we're going to talk about the anticholinergic drugs. We talked about the cholinergic drugs, and that's going to increase the rest and digest. So now we're going to look at the opposite and think about anticholinergic drugs. So we're going to block that parasympathetic nervous system. You can also think about this just as you would an adrenergic agonist, right? So it's stimulating the sympathetic nervous system. Or what would happen to your body if you're running from a bear. So again, that anticholinergic drug will block the parasympathetic response. So if you look now on page 555 in your CART text on figure 33.1, you can see the body's response when the parasympathetic is getting blocked. It looks like the same figure on page 504 when the sympathetic nervous system was getting stimulated or running from that bear. So now, can you think of a drug which would be an anticholinergic drug? Right, atropine. We talked about that before. So what will this drug do? Well, it'll decrease salivation. Again, all those things like pretend you're running from a bear. You need to have your pupils dilate. You will need to have your bronchi or your lungs dilated. You will need to have your heart rate and blood pressure go up. Your GI-GU will be relaxed because you don't have time to digest your food from the morning. You're running from the bear. Excellent. All right, so now we're going to do a few examples of some of these drugs. So a client is taking an anticholinergic drug and complains of GI symptoms. Which GI symptom would you anticipate the client has? Again, stop your video and think about it. What would it be? Constipation? Diarrhea? Are you back? Do you have an answer? Excellent. Constipation. You're absolutely right. Adrenergic, or excuse me, forget that. Anticholinergic drugs block that parasympathetic system. So they block that rest and digest. So it'll stop digestion, it'll stop elimination, or at least slow those processes down. So it will cause constipation. Great job. All right, the next one. A nurse has an order to give an anticholinergic drug to a client. Which of the following symptoms would make the nurse question this order? And this is a select all that apply. So again, before you have that sympathetic nervous system stimulated and like you're running from a bear, relax. It's a select all that apply. Think of it like a true or false question for each one of those A through F, right? So you're going to rephrase the stem of the question in front of each one of those answer choices. So I would suggest doing that, pausing your video, seeing if you can come up with the right answer, and then we will resume. Are you back? Did you get it right? Okay. So remember, an anticholinergic drug is going to block the parasympathetic system. So it will act like the sympathetic nervous system is getting stimulated. So it will cause the body to act like it's running from the bear. So if someone has asthma, their lungs will be constricted, and giving an anticholinergic will cause bronchodilation. So is that bad? No, it wouldn't be. So you wouldn't select it. Now, if someone has a low heart rate and they get an anticholinergic drug, their heart rate would increase. So would this be bad? No, because their heart rate is low. So having an increased heart rate would not be bad. So you would not select that. Now, if someone has glaucoma and they get an anticholinergic drug, their eyes would dilate, and that could cause increased pressure. So that would not be good. So the nurse would question this order. Now, if someone has tachycardia and they get an anticholinergic drug, their heart rate would go up. So would that be bad? Well, yes, because if their heart rate is already high, you're going to give them a drug that their heart rate's going to go even higher. You're concerned about this. And if you're concerned about it, you need to check with the provider, so you would question that order. Now, if someone had bladder obstruction or GI obstruction and received an anticholinergic drug, their bladder or their GI could be obstructed even further. So this would be bad. Their system would be slowed down, right? Because it would not be in that system. So this would further exacerbate the GI symptoms, the GI obstruction. So this would be bad. So you would want to question that order. Okay. Excellent. So again, in recapping this video, remember that the cholinergic agonist will stimulate the rest and digest, or the parasympathetic nervous system. And the anticholinergic drugs are going to be similar to that sympathetic nervous system stimulation, that adrenaline or that epinephrine. And that is it. Thank you very much for joining. Bye-bye.